I mentioned in your intro for the webinar that people in my family have suffered from macular degeneration. And so I was really excited about the launch of Vision. Also, in my family, there is a history of glaucoma, and it sounds like there's a history of glaucoma in a number of people who, in their families, and a number of people who were actually watching the webinar themselves. And so, as I was curious as well, they're wondering, is there anything that they can do to slow the progression? Is there anything they can do to help with glaucoma? And also asking, even, is there a possibility that if they have glaucoma, that vision could be detrimental?
So we'll touch on all those aspects. So I think to answer the last part first, I don't think there's any downside in taking a vitamin supplement if you are at risk for glaucoma or have glaucoma. There's no data that I am aware of where a vitamin supplement would harm a glaucoma patient and make their glaucoma worse. I think as far as preventing glaucoma or treating glaucoma, um, my recommendations to all our eye patients is if you're at risk for glaucoma, meaning you have a family, a first degree relative who has known glaucoma, or you have some diseases such as diabetes, which puts you at higher risk of having glaucoma, then you should have regular screenings with an eye specialist to make sure that you're not developing glaucoma yourself. And glaucoma is a very multifactorial diagnosis. It's not just one thing. It's not just high eye pressure, for example, but it's actually damage to your optic nerve, which has characteristic deficits in the visual field. So your ability to kind of see in different areas of your side vision. So the aspects of screening that a eye doctor would do would be to check your eye pressure, to examine the optic nerve directly by looking at it, to examine the drainage system of your eye to see if it's narrow or restricted in any way, measure the thickness of your cornea. There's also imaging that we do sometimes. We're looking at the thickness of the nerve fiber layer and seeing if it's thin in a worrisome pattern or it's overall thinned, and also performing a standardized visual field test where we check the side vision for any sort of deficits. And so by doing those regularly and your doctor can certainly um, review what the best plan is for your situation. But by having regular follow up, you can screen and prevent the development of glaucoma. And if you do become higher risk, they might prescribe a eye pressure lowering therapy to help prevent progression to full blown glaucoma. And if you have existing glaucoma, the most important thing is to, again, do the therapies that your eye doctor is recommending, whether that's eye drops, potentially laser surgery or other treatments, and also having regular follow up with that person, so that you don't kind of get lost to follow up and then have a progression of the glaucoma loss over time.
And from a lifestyle perspective, supplementation or otherwise, is there anything that people can do outside of the medications prescribed by their physician?
So, as far as I know, there's nothing out there in the scientific literature that shows any benefit to supplements or vitamins or um, lifestyle or diet or exercise, actually. So, yeah, right now we don't really know if any of those things could be beneficial for preventing glaucoma or assisting the kind of standard medical therapies for glaucoma that most people get.
Probably not the answer everyone was looking for, but good.
I think that early detection is the key for glaucoma because if it's detected early and appropriately treated, it can be halted in its tracks, which is exactly what you want to do so you don't lose any more vision. Um, so I think just having regular checks and following the treatment strategies that the ophthalmologist outline is probably the best way for preserving your vision long term with the glaucoma.
Good to know. I think since your webinar and as we've been having conversations leading up to the launch of Vision, the webinar really hit home for me the importance of wearing my sunglasses. in bright sunlight. I always have a hat and or sunglasses, but I've really been vigilant even when I'm running across the street about putting my sunglasses on. So I'm looking for any tips and tricks to really forestall cataracts, glaucoma, macular degeneration, whatever it may be. And I think there was a lot of really valuable information that you shared. So super helpful.
Thanks for saying that.